everyone to the webinar entitled Pursuing a Pharmacy Career in Global Health. This webinar is sponsored by the American College of Clinical Pharmacy Global Health Practice and Research Network. We can go to the next slide, please. So my name is Joe Corvino. I'm a student pharmacist at the University of Minnesota College of Pharmacy on the Twin Cities campus. I'll be graduating this upcoming May. Next slide, please. And then we're pleased to have so many of you joining us tonight for this webinar, and we just want to make sure we make it as informative as possible. For that, we have 3 objectives that we've outlined to go through. The first one is going to be describe potential global health career paths for pharmacy graduates. Second one would be listing training opportunities that position a trainee for a career in global health. Then third and finally, describe global health experiences available to students. The next slide, please. So now we'll have a brief presentation from Dr. Emily Flores and then have a panel discussion following. As questions occur to you throughout the presentation, please go ahead and type them in the chat box. We'll be monitoring the chat and we'll collect the questions for the panel at the end of the presentation. So moving on, Dr. Flores is an associate professor of pharmacy practice at the East Tennessee State University Bill Gatton College of Pharmacy. Dr. Flores grew up in Anderson, South Carolina, and has been a faculty member at ETSU since 2008. She is a family medicine trained pharmacist who seeks to care for rural and underserved patients in practice and to teach others to do so in educational endeavors. She practiced for 8+ years with an interprofessional team in family medicine and now collaborates on global and rural engagement efforts at the College of Pharmacy and interprofessionally at ETSU. She thrives on interprofessional practice and collaboration and hopes to be a part of making a difference in patient care. She serves as a teacher and preceptor for a variety of professional students and residents at ETSU, as well as in rural and global rotation locations. Alongside learners, she has served in rural Appalachia, Central America, South America, Europe, and Africa through partnerships that ETSU has developed. She enjoys active, hands-on teaching with a focus on learners gaining competency and skills to improve patient care. As an academic pharmacist, she has developed over 10 courses in classroom and experiential settings for pharmacy students, pharmacy residents, medical residents, and interprofessional student groups, ranging in topics from practice-based patient care skills to cultural competency skills and therapeutic knowledge based on curricular needs and accreditation standards at that time. Her research interests include diabetes, geriatrics, global pharmaceutical care, interprofessional education and practice, patient assessment, rural and underserved practice, and women's health. Today, she'll be presenting Pathways to Global Services as a Pharmacist. Dr. Flores?
Thank you, Joe. I appreciate that introduction and kind of summary. I think Dr. Ryan has a couple of polling questions. I think it might be a good time to do that now as we're kind of getting started with this part. So if everyone will please respond. All right, I think we're probably getting those in now. Here we go. So it looks like the majority of our audience with us today is student pharmacists. We've got some pharmacists here as well. And then a good number have done some type of global health experience before, and some of you are still kind of waiting on that opportunity. So thank you for sharing that with me. It does show that many of you will have great things to kind of share as we move towards the panel part too. Well, kind of as the introduction said, I've had wonderful opportunities to do global health service as a pharmacist, but what it didn't say was that my path was pretty twisting and turning to get there. I didn't take a traditional path. There are many pathways you can take to global service. And we'll talk about those today, but I'm just thankful for all the opportunities that I've had along the way. And several of you I've gotten to serve with before, actually. So that's pretty neat. So before we go too far, let's think about where is global service. Now, we'll look at the definition of global health, but the reality of it is we're all part of the globe. And so global service is where you are as well as in other locations. And so think about that as we move forward. As you think about how to get there, make sure that you think about being flexible and adaptable. Those are very important aspects in global health. And those of you that have traveled with me will maybe remember Gumby. Gumby comes up as kind of a model of flexibility in medical missions and in global health service. And so he'll join us as we kind of step through these components of preparing. And so some of the components of preparing, you know, are networking, training, resources, and service. And so those are kind of the heading that I'm going to look at. And so here we go with those. So global health, first off, just to remind us of the definition a little bit. We have a lot of global health going on right now. We feel more connected as we're all dealing with challenges that have come up because of the current pandemic. But global health is always there. It's an area for study, research, and practice that puts a priority on improving health and achieving equity in health for all people worldwide. So that includes your neighborhood as well. And remember that equity, you end up providing different things to different people to bring them to an equal level, which is different than equality. Here we talk a lot about social determinants of health in Southern Appalachia, where I live. In rural Appalachia. You practice interprofessionally in global health, and sometimes that translates beyond the health sciences. We have degree programs here such as storytelling and architecture that can be important components of global health. We also want to think on a population-based prevention level as well as individual level clinical care. And as a pharmacist, we end up a lot of times expanding our thought pattern beyond that individual patient in front of us to encompass more of the public health components that our core education touches on, but may not unpack as much as you will as you move into global health service. We also, kind of encounter some common challenges wherever you are. Limited access to quality medicines, limited access to care, poor staffing or infrastructure, and sustainability and cost end up to be common challenges and things that you may think about addressing as you think about how to help in global health arenas. Now, as I talked about, my pathway was kind of twisting and turning to get here. I didn't take the bottom, more direct route. And so for me, volunteering and then listening to mentors and doing on-the-job training, learning from the facilities I worked in, learning from the people I worked with, both locally in free clinics and locations like that, and as I travel, have really provided my training. And then the career opportunities can vary. We have students that have graduated from our program that are doing significant work in different short-term medical settings now in global health that didn't do a formal training path during their education. A formal training path may look more like taking advantage of classes and rotations, opportunities that your school offers, then potentially pursuing postgraduate training to really hone those skills and going for a dedicated career in global health. And that's a wonderful pathway as well. I have colleagues that have done both of these and a mix of them as well. When you think about what a pharmacist does in a global health setting, there are many roles that a pharmacist can play, and one pharmacist may wear many hats, or you may have specific skills based on who you are. So some of the things a pharmacist may be involved in is making sure that the patients or the community have access to quality medications, that medicines are used responsibly, so thinking about chronic care for chronic disease states, but also tailored antibiotic regimens. Right now, pharmacists on a global level are involved in developing clinical protocols and how to use those for COVID-19, and that applies to many other clinical scenarios. Quality control of the care that's provided around pharmaceuticals in whatever facility you're in, storage and dispensing of medications. The education component may be for individual patients, for the community. It may be broad in a lot of different varieties. Pharmacists need to be involved in health policy and making a difference. When you see a problem, trying to figure out a solution that would matter for the patient in front of you, as well as the future. Managing that formulary, we have to be aware of cost and, where to get medications from. And expanded patient care roles, I love that part. As we said, I'm a family medicine trained pharmacist. And so I love being able to provide a level of assessment to patient and work right there with the team. Physical assessment skills may really need to be honed depending on the setting that you're in, and which ones you need may vary. So just to give you some examples, these pictures are all from different trips to Nicaragua, and I like them for the variety. And so in the top left, you see a group that's listening to community health education. There was a pharmacy student sharing a presentation during this time using pictures and considering the oral culture, kind of making it come to life. We also do counseling and education on medications, and at times the pharmacist can train other members of the healthcare team and others to help provide that training. And then in this picture, you see a physician that's come in and asked me, and the pharmacy student I was working with at the time say, hey, what can we do for? And we're looking at what we can therapeutically substitute, or if we can compound something on the fly to make a difference. There's so much that a pharmacist can do, but every pharmacist has to consider their personal life too. What does your family look like? What level of support do you have there? Where would the funds come from for your global work? What are your specific interests and skills to tailor towards that? What time do you have available? And where do you want to be as far as local, global, here, abroad, things like that. So here Gumby comes back and we talk about networking. And so in this picture, you see a pharmacy student that is providing education, as I said before. In this setting in Uganda, we do a lot of networking, we develop relationships, and that has been just a very fruitful collaboration between multiple universities within the country there. But a lot of this collaboration and networking comes back to being involved in organizations here as well. The PRN for the American College of Clinical Pharmacy that's offering this webinar. Then with the American Association of Colleges of Pharmacy, you've got the Global Pharmacy Education SIG. If you're interested, Christian Pharmacist Fellowship International is a great resource for pharmacists. And then on more of an interprofessional level, Christian Medical and Dental Association is a great place for networking as well. You see, many of my advocates as a pharmacy in global health are other professions that I've gotten to work alongside. Other organizations to think about internationally, the International Pharmaceutical Federation, or FIP, is a wonderful one to get involved in. This website for medical missions helps link you to different opportunities there. And then the Global Missions Health Conference happens in Louisville, Kentucky, early November of every year. And I love coming across colleagues there as well. In this picture, you see a recent trip that I got to be a part of. So just a little picture into the pharmacy there. And in the picture, we have a variety of level of training and expertise, both in Kenyan pharmacists and US pharmacists, as well as our host, Dr. Charles Mully. So as we kind of think about networking, it is very, very important. And a lot of times it's a foundation for opportunities. We also need to make sure that we are an excellent pharmacist. So as you're in your training, think about, how can you collaborate interprofessionally? How can you learn to better communicate with all types of people? Think about getting very good at managing common disease states while considering cost and what education a patient needs to have. Tune into those components of your curriculum where you're learning community and population health. This is an area you may dig into deeper than classmates because it really is a part of global health. And then as you have the opportunity, learn about travel and tropical medicine, learn about vaccinations, learn about prevention efforts, learn about disease states that may be interested to you. Become an excellent pharmacist and your skills will translate to wherever you have the opportunity to practice globally. So with that training, here you have a pharmacy student that I had the honor to travel with, providing some patient counseling there. We do that very commonly. This was an interprofessional trip. In our program, we do offer credited trips, but we also provide opportunities for volunteer trips. There's local global service, and other universities provide this as well. So find out what your college offers and take advantage of it. The top 2 bullets there are electives that we offer, and those electives cover things like what is global health and what are different perspectives and different cultures. What does practice look like in different healthcare systems? What are common disease states worldwide, and how does it look different in different settings? And so take advantage of what your school offers there. We also offer an interprofessional global health certificate, which is a neat opportunity. And there are many opportunities out there. One exciting opportunity that I want to make sure you all know about is our PRN, the ACCP Global Health PRN, now has this wonderful postgraduate training resource that you can access. And the link is at the end of my set of slides here. But here there are over 25 different postgraduate training programs that you can look into and see how they match your interests. So take advantage of checking that out. Then beyond that, the American Society of Tropical Medicine and Hygiene does provide some certificate programs, diploma programs for those that are more advanced in their global health service. The Global Health Corps is another resource potentially. They're doing some things with the COVID-19 response now. Perspectives on the World Christian Movement is a training program that I did and really had some great experience and great learning points there. And then community health evangelism is another consideration. Learning about community health ends up being very important when you're talking about global health. And down here, as Gumby moves us along to resources, this at the bottom is a good online resource for community health education. So that's hepfdc.info. And that's a great resource that you can download from. And then I have some books that I always recommend. I think every student before they travel should read Foreign to Familiar. It's a quick paperback. You can get it on Kindle. It only takes a couple of hours to read, but it really helps build out the framework of what makes up culture and helps you tune into some of those components. I've had students that I've worked with say, you know, I did this trip before I read the book and now I've read it and I wish I had read it before. Then I also recommend these middle 2 books, When Helping Hurts and When Healthcare Hurts. As you're starting to try to build your framework for what does it look like to do these things well, they are great books to read to help you kind of learn from some of the challenges that have been seen before and try to do better as we move forward in partnerships and in service. And then finally, the Handbook of Medicine in Low Resource Settings. This is a great resource for how do I treat this? And so it's something that I always travel with. There are many other great resources out there. I just wanted to give you all a sampling today. And I'm really just kind of trying to start discussion and get you all thinking so that our panel can really respond to your questions and shine there. So the last kind of component Gumby said we need to look at is service. And I wanted to start locally. So your local global service, think about in your area, churches, community organizations. Do you have a community cafe? Do you have crisis pregnancy centers, free clinics, shelters? Where could a pharmacist be involved with a broad skill set? Where could you serve? And, you know, how would they want you to serve? I've had wonderful opportunities locally to start getting our students more involved in some of our rural and underserved clinics. And it's a little different at every location what role the pharmacist or pharmacy student can do. Other local opportunities for you may be mobile dental or medical clinics, depending on what's in your region. The Red Cross, remote area medical events, which we participate in our regional event and contribute to some other area events, the Salvation Army. I've done Southern Baptist disaster relief training. That's a little broader than a pharmacist skill set. The state health department or your regional health department, that's actually, you know, your health department may have a current need even as this crisis is going on. So that may be something to help with. And I've talked with multiple pharmacy students before that, you know, ran call lines while they were in school, whether it was a crisis pregnancy call line or suicide hotline, different things like that. And so there are many components that you can be involved in global service without travel and while you're going through your education. Then you may think about, well, I've got to do this pharmacist job. I've got these loans to pay, or my direction isn't full-time global service. What can I do? There are some great short-term medical missions that you can do. Global Health Outreach is who I've traveled with a lot. I've had colleagues travel with Mercy ships. I've been to One World Health clinics. I'm in contact with Project Hope, and they're doing some things for the pandemic response. And Project Cure is another example. But as you're thinking about an organization to work with or a partnership to develop, think about what the goals of your partner organization is. Those are the goals that need to be met. And so are those the goals that work for you? How can the partnership be mutually beneficial? And also a good question to ask is what happens when you're not there? And then rounding out the service component, global professional placements. And so there are other resources here, but you know, one great opportunity is U.S. Public Health Service. That is absolutely global service, a great place that you can be involved if you wanted to be commissioned or to work as a civilian. You would have some of the components of global health. Doctors Without Borders or Médecins Sans Frontières is a great resource and will utilize pharmacists in some of their placements, but it may be challenging placements. International Mission Board, potentially. World Medical Mission, that is through Samaritan's Purse. And so that would be another option. And there are others, I'm sure, that we could add to this list. And so here you have a picture of a short-term medical pharmacy, but we were actually set up in what was a longer-term pharmacy there. And I always like to label the shelves, and so that's what the labels are. They're English and Spanish, since that was the local language. But kind of one thing I wanted to bring home as I wrap up my little bit is you can prepare for global health service anytime. And so I remember before I got to travel that I wanted to go, and there have been multiple times in my life where just working on this component rejuvenated me, even when I wasn't getting to go or getting to travel then. And so you can prepare anytime. You know, do personal preparation, do cultural preparation, prepare well professionally or interprofessionally. You can prepare anytime in different components. Use those resources, network, think about opportunities, become the best pharmacist that you can be. And this picture here, it was just a wonderful opportunity. I got to counsel, but the baby that's on her back there was septic when she came in that day. And so she was getting a lot better over the course of the day, but we were keeping a close eye on her and Mama too. So here's that link that I mentioned for the directory of the global health opportunities for postgraduate pharmacy training. It's a great resource to check out, may help motivate you, give you something to look forward to as a student. And then I also wanted to include my email here for anyone that might want that. I'm happy to help at any point in the future. And then I am turning it back over to Joe at this point.
Perfect. Well, thank you, Dr. Flores. That was a really interesting and informative presentation you just gave. So now we're going to take a turn and go to our panel discussion. I'll first introduce Ria Saltow. Ria is a student pharmacist in the class of 2021 at the University of Houston College of Pharmacy. Ria, I'll let you take it over. Hey, Ria, I think you might be muted.
Oh.
Now you're good.
You can hear me now? Sorry, my computer must have. Okay, so as I was saying, we're going to move into the panel presentation. And it's my pleasure to introduce the panelists. As you have questions, please feel free to put them in the chat box. and I will collect those and ask our panelists for you. Okay. So Dr. Sarah Descano is a postdoctoral global engagement research fellow in the Office of Global Engagement at the UNC Elmhurst School of Pharmacy. She grew up in Blacksburg, Virginia, then went to Virginia Tech for her Bachelor's of Science in Nutrition. She received her PharmD and MPH with a concentration in Health Services Administration from the University at Buffalo. During her fellowship, she spent 4 months in Lilongwe, Malawi, helping to implement new clinical pharmacy services in a tertiary hospital. Additionally, she helps coordinate various global health programs for the university, including their International API Rotation Program, and helps teach in global and rural health elective. Her research interests include global pharmacy education and quality improvement research in limited resource settings. We just heard from Dr. Emily Flores, as she's been introduced, and she will also be part of our panel today. Dr. Lauren Jonkman is an assistant professor at the University of Pittsburgh School of Pharmacy. She serves as the coordinator of International Pharmacy Student Experiences, co-director of the Area of Concentration in Global Health, and co-director of the Global Health and Underserved Care Track within the PGY2 Ambulatory Care Residency Program. Within the school, Dr. Jonkman mentors students and residents on research and practice experiences working in limited resource settings in Pittsburgh and around the world. She co-coordinates the Population Health and Management course, coordinates a global health elective, and coordinates an elective in Namibia during spring break and in the summer for students to learn about healthcare provision in a limited resource setting. In Pittsburgh, as a pharmacist at the Birmingham Free Clinic, providing direct care for non-communicable diseases and teaching care to underserved populations. Since 2005, she has supported clinical practice development and research with Shoulder to Shoulder Pittsburgh San Jose, a community-oriented pharmacy care nonprofit rural in Honduras. Since 2015, she has provided clinical support and teaching at the University of Namibia. In 2018, she served as a Fulbright Scholar with the university and now has been appointed as a visiting professor. Dr. Adesumbo Odulami is the PGY2 Public Health Pharmacy Resident at Bristol Myers Squibb and Fellow at Rutgers Institute for Pharmaceutical Industry. During this residency, he spent 6 months working throughout sub-Saharan Africa with NGO, NPO, and Ministries of Health. He graduated from Temple University School of Pharmacy in 2018 and went on to pursue a PGY1 residency at the Wilkes-Barre VA Medical Center. His future goals included improving health outcomes, improving cancer disparities, and increasing access to care for the underserved patient populations. So welcome to all of our panelists, and we will go ahead and move to our first question. Okay, so it looks like one of our first questions may be Dr. Emily Flores. You mentioned a lack of sustainability as a common challenge in global health. What are some methods or resources you use to develop sustainable programs?
Yeah, thank you. That's a good question. The sustainability piece, I think Dr. Jonkman can speak to as well. But a couple examples. So in Uganda, our university has a partnership there, but there are 6 other universities from the United States that have partnerships in Uganda and a couple of universities there. And so we kind of have a network which has helped kind of keep us working together and the overall goal being pharmaceutical care improvement. And so for that, it really is networking and shared goals and constant communication to kind of keep things sustaining and moving forward. So that's one piece. I think a lot of what helps make sustainability is going, developing long-term relationships that are mutually beneficial with locations and investing there and having bilateral partnerships as much as possible. And so that helps sustainability. And sometimes the sustainability is the faculty member, because the students do change and you want to have that experience, as students. What do you want to add to that, Dr. Junkman?
No, I mean, I think that's true. I think that sustainability is one of the biggest challenges with, pharmacy student involvement in global health. So, I've shifted, I think, my kind of practice over the years. And now, my focus is more on creating these kind of sustainable relationships. So my work in Namibia is around supporting Namibian pharmacists to have improved confidence in their ability to provide training or to train others and to provide clinical skills. I'm not licensed pharmacist there, so I don't practice, I teach. And then the place that the students fit in is in helping there's lots of pieces to that, but somewhat is also to help increase the pharmacists' awareness of their own skills in their own ability to teach, and to see how training across multiple countries is really similar, and that their skills that their capabilities are transferable across multiple settings. And then the other piece of it is that, by the students coming, that is able to sustain this relationship of me as a faculty member being able to go and serve. So it's kind of this kind of bidirectional, sort of bidirectional. The problem is always money. I think that's the big comes down to, right? So ideally we would have full exchanges where, students from one place would go to another and then vice versa, but it's not an even trade. It's hard for it to be an even trade because it's more expensive to come to the United States than it is to go to many low-income countries. And, the US is not incredibly open about visas and supporting people visiting. And so there's some inherent challenges, and that impacts those relationships.
Great. Thank you both so much. It's so true. Sustainability is so many different components. Okay, so we have our next question. This will be for Dr. Odunlami. Can you please elaborate on your path on your PGY1 experiences?
You're muted.
Yeah, sorry about that. Thank you for the question. So I think the question was just elaborate a little bit on my PGY1 and PGY2 experiences. So as was earlier stated, I attended Temple University, graduated in 2018, and throughout my time at Temple, I participated in global health mission trips. Our school offered some. I went to Panama. Then even before I was able to do that, me and a group of students formed together to go to Haiti together, and we kind of built that mission trip on ourselves, and we took a preceptor from school as well. So I was always interested in the global health aspect, but obviously, I kind of wanted to get more training as a pharmacist and, a practitioner of just being able to offer better, clinical practice. So I went on to pursue a PGY1 at Wilkes-Barre VA. And why I chose the VA specifically is just because I believe that the VA is a little bit more progressive in how they allow pharmacists to practice. You get the ambulatory care setting where you're seeing patients, you're monitoring therapy, you're adjusting medications, and this is kind of vital when you're going to go out into these global health mission trips, and you may not be accompanied by a physician or a nurse practitioner, so you can be able to, with reasonably give good medical advice. Then, as of now, I signed on with Bristol Myers Squibb and Rutgers with this one-year program where you spend 6 months through sub-Saharan Africa, and then another 6 months back in New Jersey. So that's kind of the quick and dirty of my my experiences there. And I can elaborate if there's any other questions on like my 6 months in South Africa or Sub-Saharan Africa and what I did.
Thank you so much for that. And yes, I'm sure we will definitely circle back as more questions come in to learn more about everyone's journey. So we do have another question. I think this goes to all panelists or whoever would like to take it. So would you recommend for pharmacists interested in global health practice to pursue an MPH degree?
So I can answer, and this is from Dr. Cope, who was one of our residents in our program a number of years ago. So I don't think it's essential that that you know you get an MPH. I think the value of the MPH is to provide another set of skills and another framework to view your involvement and how you can improve systems and how you can improve care, I think, in a different way than maybe what you learned in pharmacy school. And there's a variety of different MPH programs. Even just at the University of Pittsburgh, there's 5 different tracks within the MPH program. So there's community and behavioral health sciences, there's epidemiology, there's health policy, there's so many different areas. And so I think that it truly depends on what your interest is and what skills you need to be able to get to where you're going. So maybe taking some behavioral and community health sciences courses will help you to be able to do more, build some more sustainable community education programs. Maybe you want to get involved in, the CDC and having some training in biostatistics and epi is important for you. So I don't think it's essential, but I think it can be helpful depending on your path.
I'd like to hear what Dr. Descanio thinks about that too.
Oh, you're muted.
Can everyone hear me now?
Yeah.
Okay, good. So I did a dual PharmD MPH during my pharmacy, degree. And I would agree, having an MPH is not necessary, but I think that a lot of the skills that you learn through there can be applicable to global health. And in fact, the UNC Public Health School recently changed their name to the Gilling School of Global Public Health because they recognize that all public health really is global health as well. And so with that being said, I've used a lot of the skills I learned throughout my MPH, like program planning and evaluation, my research skills, community engagement throughout my fellowship experiences as well. So I wouldn't regret it for anything. I would do it again in a heartbeat. But I think similar to what Dr. Johnson said, it just kind of depends on what pathway you're looking to take and what other skills will be useful for you in that path.
Great, thank y'all so much. So we have another question for Dr. Odenlami. What initiatives does a pharma company like BMS take to enhance global health?
No, that's a great question. And I think BMS does a good job of being a leader, not as, in this area where we have a dedicated foundation to offering our services as far as providing access to advanced medications. And I think one thing that pharma companies can do, when we speak about global health, I think it's not just the nonprofits or the academic centers. I think we have to come to this as a multi-centered collaboration, what each parts can do best. And I think what pharmaceutical companies can do best is they're really good at delivering services quickly, the supply chain, as well as making sure that these initiatives are cost effective. So our foundation is really kind of geared towards more so cancer disparities and providing these advanced medications, precision medications to LMICs. So that's kind of where we fall in terms of, the global health market and as far as disparities go.
Okay, thank you so much. So we have another question for Dr. Descanio. There are 2 fellowship programs at UNC. How are they different?
Okay, I think I'm unmuted now. So UNC has many different fellowship programs, both in academics, research, and then we have 2 that are in global health or global focus. And so one is our Farm Alliance Fellowship, and so Farm Alliance is our 3-way partnership between UNC, University College of London, and then Monash University in Australia. And so that fellowship is really focused around like relationship development, international relations, leadership, teamwork, those kind of aspects, with still some research and teaching integrated. For my fellowship, it's more focused on just like general global health concepts and global education. So I'm heavily involved in like global health and global education research. I help out with teaching and then managing and doing program management with our various global programs. So we overlap a little bit, and we definitely work together and collaborate on many different things, but that's kind of how you would differentiate.
Great, thank you so much. So it looks like we have a question for Dr. Jonkman now. What was your level of involvement in global health as a student, and how did that direct your career path?
Oh, that's an interesting question. So I was really, my interest and focus as a pharmacy student was on social justice issues. I was really heavily involved with our free clinic, which is where I work now, doing a variety of different things and just kind of putting in the time to learn from the people that go there, to learn from the other, healthcare providers, to really like Dr. Flores said, really focusing on honing your skills. And I did have the opportunity to do an international rotation when I was a student. I talked to my mentor, who I work with now, Dr. Sharon Connor, who many of you know. And I said to her one day when I was at clinic, I would love to get involved in global health and figure out how to do that. And she's like, well, it turns out that we finally have everything set up to do a rotation in Honduras after a long time. So I was able to go as a 4th-year student. And then again, I was able to go as a resident. I stayed within like the kind of University of Pittsburgh system. And so I went to the same site as a resident. And I think so much of this is taking those opportunities when you find, like when they appear to you, not being afraid to say like, yes, to seek out those opportunities, to tell people what you want, because you never know what is possible. And as a faculty member, I can't read people's minds. So unless someone tells me what they want, like I can't help connect them to it. So I think that's really one of the key things, the thing that I learned the most. Yeah.
Thank you so much. So we have another question for Dr. Descanio. Is PGY1 or PGY2 a prerequisite for a fellowship in global health?
That's a good question. So I actually did not do either PGY1 or PGY2 before coming into my fellowship. So no, it is not a prerequisite. It can make you more competitive if you do that. But I think it kind of depends on where your focus is and where you want to go with this. I knew I didn't want to take a clinical route after. And I wanted to focus more on public health concepts using my MPH. And so for me, I didn't feel that doing a PGY1 or PGY2 was necessary for that. So I guess in short, no, it's not a prerequisite.
And another question for you, Dr. Descanio. So can you tell us about your experience implementing new clinical pharmacy services in a tertiary hospital?
Yeah, so that's a good question, I would say. So I'll give you guys just like a brief overview. But I was lucky enough to spend 4 months in Malawi implementing a new clinical pharmacy services at one of the hospitals. And so I was really just kind of like a facilitator or a catalyst in all of these, the development of the services. And so if any of you guys have been to Malawi, you'll know that a lot of the focus is on just dispensing of medications and supply chain management. There hasn't been as much integration into those clinical services, and so that's really what we were focused on, is doing a quality improvement project within the hospital to figure out what would that look like for the setting, is it feasible, what would the adoption be within the hospital. And so it's been really successful. I was a little bit surprised with how good of a response we've had from it. And so now it's been going on for about 7 months now, and it's still continuing. So it kind of goes back to that sustainability aspect that we had talked about. So yeah, it's been a really great experience. It was challenging, I would say, definitely. There's a lot of barriers that come up just with limited resources and trying to make sure that you're really tailoring programs to that community's needs. But it's been a wonderful and valuable experience.
Awesome. Thank you so much. Yeah, I can imagine that was really, really neat experience. So it looks like we also have another one for you. How competitive is it to get the fellowship, and is MPH a requirement for the fellowship?
So both good questions. So MPH is not a requirement. The past 2 fellows before me, so I'm the 3rd fellow in this program. The previous 2 both did not have an MPH, although I think both of them went on to get an MPH after the fact. So I thought it would be useful for the activities that they were doing. As far as how competitive it is, I think it's definitely been increasing every year, just as more people gain awareness of the program and have more interest in global pharmacy. But I mean, I would say it's comparable to like what PGY1, PGY2 would be like. It's definitely going to be somewhat competitive, but that's where you have to try and make yourself a strong candidate before you go in.
Yes, thank you so much. So it looks like we have one for everyone or whoever would like to answer. So from the pharmacist perspective, what are current gaps in global health that the next generation of pharmacists can start working to fill?
I think one of the things that we all need to be moving towards as a pharmacist is advocating for ourselves, advocating for expanded pharmacist services, and supporting our colleagues around the world to be able to provide expanded care for their patients and their communities. And so that's why so many of the pieces we talk about are educational. And like Dr. Descanio was saying, trying to implement new clinical protocols and trying to strengthen the patient care services that we're providing. And so, yeah, to expand the healthcare workforce as a pharmacist with kind of a patient-centered role is one aspect. I'm sure there are others. I'll let others comment.
This is a good question. I don't know if I have a really good answer. I think it's been really interesting seeing how, you know, the coronavirus pandemic and COVID-19 has highlighted some huge issues that we have with health infrastructure everywhere. And so I think that from this and kind of the next generation, I think we'll be in a different position, hopefully a better position, to advocate for improved health equity and justice everywhere, and how that focusing on that from a health, at least from a health side, would have potentially had impact on how things played out in the virus. I mean, if we look at who is being infected in the United States, it's, you know, people who are the most vulnerable, and how do we address that, and how do we kind of fix the system that we have that increases the disparities, and the issues that we see in the US are the similar issues that we see in many other places. And so I think that's what I would say is this kind of next issue, is is to think about how do we address these inequities and injustices and work to reduce them.
Just to second that point, and I completely agree with everything that was said, but I think one thing that's also overlooked is delivery of healthcare services. And it's one thing to build these services up, but how do you deliver it to patients? Because not every patient population, as far as where they live, have the same access. And I think one thing that the COVID has taught us is, well, telehealth, as far as telecommunication, being able to talk to any provider, pharmacist through the internet and telecommunication, that wasn't being reimbursed as something viable. And I think this is something that's going to gain a lot of steam. So how do we leverage, things such as COVID and new technologies that are coming back to enhance access to these, infrastructures that we build? And then just one second point, not to be so long-winded, but especially when we're talking about LMICs, once again, building is one thing, then how do we deliver those services to those patients in rural communities, patients who live much further, patients who can't afford to take one day to travel to the clinic? And I think that's one important thing that sometimes doesn't get the focus that I think the next pharmacist should take that mantle up.
Mm-hmm.
I'm in full agreement with you, Dr. Adolami. The community pharmacy is about the furthest you can get into the rural environment, but there's still rurality beyond that in these places. And so how to take that impact further. Great thoughts.
I can add on just, I guess, one last thought on that. I think for me, this is a hard question because there's so many things I think we could contribute to. And so I think for me, just being more intentional in our everyday actions as pharmacists as to how they align with the global health agendas, because we're doing things every day that are dealing with non-communicable diseases and infectious diseases and access to care. And those are issues that are worldwide, right? Just being more intentional in how they actually align with the global health agendas and what everyone else is doing, I think is a great way to kind of start bridging some of those gaps.
Thank y'all all so much. So we're getting close to end of time, but we still do have a little bit of space for a few more questions. So we got another one from Brooke. It says, I've also done quite a bit of work in Malawi and Uganda with a focus in pediatric heme-onc. How can we improve networking within ACCP to enhance awareness of our efforts and try to identify synergistic efforts and collaborations?
I think so. I think this is a tricky question. So in the Global Pharmacy Education Special Interest Group in AACP, because I see there was a sub question down here about a database of current activities, we had talked about doing that, and at least a lot of schools of pharmacy are not open to talking about where they have partners and where they're working. I think some of it is because people are very protective of their sites. So I think that makes it kind of tricky to be able to work together. I think it's super important that we do. I mean, I think as much as, we can, I think a lot of the key players in countries are findable. For instance, in Malawi, I mean, UNC's got a huge site, like a building. Baylor has a huge building. So if you're looking for people to partner with, you go to the people who have those big buildings and have invested infrastructure. So I think it's possible to do that. But yeah, no, it's a tricky thing to get everybody on one page because not all the pharmacists are all in the same organizations, right? Some of us are in FIP, some are in AACP, some are in ACCP, some aren't members of any of them. And so so it's a tricky solution to try to figure out how to get everybody on the same page, and maybe other people have great ideas. Yeah.
I mean, for me, it comes back to the networking piece, and it would be great for, it to be formal, but a lot of times this stuff happens over coffee and because somebody said Uganda and my heart leaped and pieces like that, because we're passionate about what we get to do. And so I'm always happy to put you in touch with or kind of include you in Uganda conversations, just to kind of better know. And some of it's, we know each other are doing things, but we're doing different stuff. But it's good to just know. And so I'm all for networking and collaborating in the ways that our organizations will allow us to do so.
This is Susie Crow, so I haven't spoken up yet on this call, but as the chair for the PRN until October, I would love to entertain more ideas on how we do this. I think it's something, regardless of where we're working, we can learn a lot from each other. One size doesn't fit all for everything that we're doing as far as, projects or interventions, but we can certainly learn a lot from each other. And I would, if people want to continue this conversation afterward, I would be happy to continue this, because I think it's a really important one. I feel like sometimes in global health, we tend to err toward like being really protective of what we're doing and almost a competitive side. And I think that there's so much that we can accomplish if we work together. So I 100% second what you're saying. So if you want to talk about this afterward, I would love to.
Okay, thank y'all so much. We're getting close to time, but I thought maybe we'd have time for one more question. Just a follow up from the previous one. From the student perspective, I think many of the concerns are that the market is saturated for pharmacy, and that's a lot of the conversation nearing graduation. So with global health still expanding and clearly so many things that we can do, such as access to these resources that we're building, not just building, but also making sure that they have access. What are some things that students can do now to get experience in that so that they can become proficient at this as providers when they graduate or become residents?
I think that Dr. Flores spoke a lot, gave some really good examples of ways to get involved. And I think that the important thing that she highlighted is that, the needs around global health and addressing, health equity are not things that happen only in other places. And so the skills are absolutely transferable, right? Like the work that I do at the Free Clinic in Pittsburgh, working specifically, we take care of also a super diverse population. On a given clinic day, I'll have patients from 4 different continents sitting in the waiting room, right? So we're seeing, we see a huge diversity, and we also see lots of needs, and those skills are equally transferable when I'm in Namibia and I'm, teaching master's students about how do they address a patient that's in front of them? How do they do, how do you interview and address somebody, address hypertension in a situation? Like there's, it's all this kind of listening skills, reading, talking to people, getting as much opportunity to practice. And that doesn't mean that you have to leave the country to do that.
Also, and I would just like to say, as far as just the market being saturated, it'll be saturated if everyone as global health expands, there's going to be more roles for competent, trained pharmacists with this new skill set. And I think we're limited only by what we think we're able to do, right? So no one thought of pharmacists having an impact in global health, right? And here we are, so. And I think there's many more roles that we can expand to. So I just think it's only limited by however you want to limit yourself.
Okay, thank you so much. I think that was fantastic. So this does close our panel and the webinar for today. I would like to thank all of our participants for such great questions for the panel, and thank you, panel, for all of your amazing, insightful answers. Additionally, I'd like to thank everyone specifically, which is Dr. Descanio, Dr. Flores, Dr. Jonkman, and Dr. Odunlami, for your insight into a career in pharmacy of global health. Please, everybody who's on, don't forget to go follow ACCP Global Health PRN on the platforms. There's great information that comes out all the time, things like these webinars that will be coming out more and more often. And then you can always let us know what you would like to hear as well. So please keep watching for the next webinar, which will be scheduled this fall. You can also follow the PRN on all of these handles, not just one, follow us all. And thank you and have a good day, everyone.
Thank you, guys.